Our next and final speaker before we go into the panel discussion section of the webinar today is Barbara Crowther from the Children's Food Campaign. And Barbara is going to talk about campaigning children's rights, parents' power and government action to improve the food environment's short-term support and long-term impact. Thank you, Barbara.
Thanks, Kath, and good evening, everyone. Just a quick word about the Children's Food Campaign. You can see us listed there in sort of, we've got our own little ecosystem of food-related campaigning, which range from looking at food insecurity and the right to food, through to local food, partnership building and governance, healthy food, and then also connecting supply chains around farming, fishing, production, and at the moment also trade, and looking at, you know, could the new trade deals also have an impact on our ability to tackle child health and take the policy interventions we need to. Can we move on, please? I'm taking, again, a slightly different tack on the conversation tonight, and I wanted to just kind of touch on a few COVID big themes, and the work we're doing around trying to create a healthier food environment for children, for families, and for everyone, kind of sits in this kind of bigger landscape. And what we saw during COVID was this, you know, this kind of double-edged sword, where we had on one side a real profound, you know, lesson in the fragility of our food system. So before COVID struck, there were 8.4 million people living in food insecurity, 1.3 million undernourished elderly people, 1.5 million children eligible for free school meals, but actually 4 million children technically living in poverty, and a lot of children falling through the net in terms of access of free school meals, and a lack of adequate measurement of all of that food insecurity. And so when this pandemic struck, there was a real scramble, and as the shelves of the supermarkets emptied and people started to isolate that access to food and who was around to provide it and how quickly that mobilized became a real issue, not least, of course, for people most at risk and people living with obesity. And the Independent Food Aid Network reported that in May 2020, the amount of food bank usage had risen 177% compared to May 2019. And their phrase was, "and there is no end in sight." So that was progressively increasing as more and more people kind of became food insecure. And as Harry has just, you know, really well illustrated, there is an absolutely direct link between food insecurity and the ability to access not just food and not just tackle hunger, but to access adequate nutrition. And some of the models of delivery that were then put in place, you know, you have breaks and bid food stepping in with the emergency parcels. Some of the quality and nutritional value of those parcels was far from adequate. And on the other hand, we saw some incredible community mobilization, some networking. We saw businesses transitioning from especially in the hospitality sector. School caterers started turning to Meals on Wheels. We've got a report on the Sustain website about that. We saw a huge uplift in people ordering veg boxes and the connection into new supply chains. And school leaders turning into people who really started to understand who had nutritional needs amongst the families, and stepping outside of the formal eligibility definitions to try and just ensure their families and their children had access to food. And what we also discovered was that the areas where there were food partnerships that were working across public health, food co-ops, local food provision, were putting together the best schemes, the schemes where parcel delivery was going to the people in need, was looking at the ethnic needs of different types of communities, were putting in place their own nutritional guidelines, because the public health people were connected into the food people. And I think that there's a real lesson that we can take out of this from that, about how do we build those partnerships at local level to deliver. We move on, please. And my role in the Children's Food Campaign really kind of then zoned into what is going to happen to the children who are most at risk of food insecurity, who typically access free school meals. And the Food Foundation reported midway through the lockdown that around 200,000 children were reported to have missed meals. But I think more than that, I think children started to report that the quality of what they were able to access, so fresh fruit and vegetable consumption really plummeted, and children reporting that they could only afford very cheap and not very nutritious food. A study in Northumbria has looked at what happened to the families who were reliant on vouchers, and again, a real drop in fruit and veg consumption amongst amongst around half of the families that were accessing fruit and vegetable, accessing the voucher schemes. The charity Bite Back 2030, which is supported by the Jamie Oliver Foundation, their youth-led network, and their research has shown that amongst teenagers, 57% more teenagers have reported that they snacked a lot more during lockdown, and that number rises to 63% for the lower income brackets as well. So trying to then find ways of continuing provision. And again, we saw that there was a bit of a scramble to repurpose food that was going into other parts of the hospitality sector into things like school parcels, and children being educated in lockdown, being sent a weekly parcel that included an entire loaf of highly processed white bread, multiple sachets of ketchups and sauces that normally go into the pub chains. All sorts of things were making their way into what should have been a parcel that was done in line with the school food standards. And then, of course, what happened during summer holidays, and we coalesced a big group of organisations to ensure that there was still access to food through the summer holidays. And we saw the big Marcus Rashford campaign. I think some of us have been working for 3 months before Marcus trotted up and kind of kicked the ball into the net, to coin a metaphor. That was a big acknowledgement of the fact that there was a universal need beyond just the projectised support for summer holiday food provision to children living with food insecurity. But the voucher scheme is definitely not our preferred mechanism of delivery in terms of the way it's engaged with retailers and whether they're the right retailers, the flexibility of the programme, plus that ability to ensure that public money turns into nutritious, healthy food. And I think that's the win-win, where we tackle food insecurity and healthy food hand in hand. And we then also had to push for the reinstatement of the school fruit and veg scheme, which has now been confirmed. And also for children from immigrant communities living with no recourse to public funds, where there's been an extension, but not a permanent one. Can we move on? Thanks. And the other aspect of our work was actually monitoring what companies were doing. And we did see a rise in companies kind of positioning themselves as, heroes. So your delivery driver became a key worker and a national hero. Companies providing Zoom backgrounds for your online calls. The kind of the Krispy Kreme delivery to the NHS. We saw a lot of products kind of trying to be offloaded into food aid. And so again, trying to kind of break that intrinsic link between food aid and food insecurity and getting the right kind of health and nutritious food in, but also challenging the way in which that constant stream of nudging towards the less healthy food options continued all the way through lockdown, online, on TV. ITV had an ad break which involved Haribo and Walker's Crisps, and getting the public to remake their adverts. Can we move on? On the obesity plan then, so through through the most recent period, we continue to bring that evidence to the light of government. So we strongly welcome, like Harry before me, many of the commitments. We've been working on these. He's absolutely right. It's been consulted and consulted, and we've been waiting for the outcome of many of these. We've got some reservations around calorie labelling, and we know that people working with those with eating disorders have got some concerns about that, and needs to be managed quite sensitively. But we still need a whole lot more measures that respond to the environment around us. And I totally agree. We need the kind of measures. We've seen how the soft drinks industry levy has taken sugar out of drinks, has forced that reformulation and taken that personal choice away. We've not seen in the current government announcement the ban on energy drink sales to under 16s, and we know the problem lies with corner shops. So that's, we still need to see the public funding coming down into the local level where people can go into the communities where support is most needed. We still need the early years and infant feeding strategies to be put in place. I think the next one's my final slide, and then I'll stop. So we've got priorities around making sure when schools come back in September, how do we get that healthy food culture back in place? On the one hand, how do we make sure we tackle the eligibility of the much increased level of food insecurity on the other hand? And final slide. So, you know, in summary, our view is sustained in terms of this systems approach. We won't tackle food insecurity and obesity and overweight unless we go into the root causes of poverty and food insecurity. We need policy to support healthy, fair and sustainable food systems. We need our trade deals not to allow in some of the lower standards, or to open us up to challenges about our right to label food adequately. We need to champion a diverse system that kind of brings in small and medium enterprises, local systems, and above all, we need to create that healthier food environment that Harry articulated also really well. So let's learn from this crisis and apply it to the next level of upheaval that we're going to have through the trade negotiations and any second wave. Thank you very much.